Can I get HIV as a top?
How often should I get tested?
What is syphilis?
What is an undetectable viral load?
Can my partner and I get tested together?
How do I tell my partner I have gonorrhea?
What kind of lube should I use with my toys?
Can I get chlamydia in my throat?
What is my risk for HIV?
Do they make condoms in different sizes?
Is there someone I can talk to about my...
PrEP is pre-exposure prophylaxis, and essentially what that means is it's a medication that a person can take before becoming exposed to HIV to prevent HIV acquisition or becoming infected with HIV. So PrEP is something that you would get through your medical provider, and it is a prescription, so you do have to see a doctor in order to get the prescription. Part of the processing includes an HIV test, a hepatitis B test, and also some liver and kidney panels along with other body function blood tests. You can move forward in that conversation with your provider. Some things to consider about PrEP is that it isn't very cheap. So if your medical insurance doesn't cover it, you can always go to start.truvada.com to get information about financial assistance to help with high copays for the prescription. Some other things to consider is that PrEP is hard on the body, and so if it's something that you feel like may not be a good fit for you, there are other options to help reduce the risk of HIV transmission. PrEP doesn't protect against gonorrhea, chlamydia, or syphilis. So it is important to continue using condoms if you're not sure of your partner's other STD statuses. Having PrEP in combination with the use of condoms and the absence of STDs can greatly reduce the risk of HIV transmission. So just another tool in the toolbox.
So PrEP is a really great prevention tool for individuals who might be at high risk of contracting HIV. So an individual might fall into the high risk category if they have any of the following characteristics. So if they have been diagnosed with an STI in the recent past, or if they have had multiple sex partners, or if they have a sex partner who's HIV positive, or if they are doing commercial sex work or exchanging sex for anything of value or any goods that they may need, or for those individuals who have trouble using condoms consistently and correctly. So I know that some folks out there don't like to use condoms, or they may combine sex with drinking or any types of other drugs. So PrEP might help curb against HIV infection, but STI infections, aside from HIV, are certainly something to still be concerned about. As with any prevention tool, there are pros and cons. So some of the pros of PrEP are that it's really effective. Studies have shown that it's up to 92% effective when used properly and consistently. And so a doctor or your primary care physician will be able to run through that process with you if they do prescribe PrEP to you. Some of the cons of getting started on PrEP are that it is really expensive, and sometimes insurance companies won't want to cover the cost of the medication. Additionally, some doctors or primary care physicians, they won't want to prescribe it to individuals, be it because of stigma or because they don't want to go through the process of testing an individual regularly for certain things. So, some other side effects might have a negative effect on an individual. So those could be loss of appetite, headache or nausea, but no serious side effects have been reported with PrEP.
I'm Boone. I have chosen not to go on pre-exposure prophylaxis because this was a decision my doctor and I made together. After explaining my history with my doctor and my practices, he decided that he wouldn't refer me to use PrEP at this time. My boyfriend and I are currently monogamous, and because of this, my doctor didn't think it was appropriate for me to be on PrEP. He did tell me, though, that if anything changes with my relationship, that I should come in and talk to him again about what PrEP would look like for me and if it would be good for my lifestyle. But based on my relationship now, it's not an option. It's not the best option for me. I'm using other prevention tools to keep my HIV status negative.
Hi, my name is Robert. I'm an editor volunteer for Pivot. About a year ago, I was reading about the PrEP program. Then a few months later, my partner and I were talking about being sent into the PrEP program. I went to his doctor because he's HIV positive. I do use condoms. Then later on, I went to my doctor. Then he asked me a few questions like, what is Truvada? What kind of side effects? He asked if I was practicing safe sex. Then she ordered some blood tests like liver function tests. So she had it ordered to make sure I was HIV negative, and some more kidney function tests. Then after I get the results a month later, she prescribed Truvada as a prophylactic. I've been on Truvada for about 5 months. I have the only negative side effects I experienced from Truvada is being sleepy in the morning. And every 3 months I have to do another HIV test, another kidney function test, a liver test. And I hope to make sure that every day I check Truvada every day.
My name is Luis, and I'm in a zero discordant relationship. Me and my partner, we've been together for about 5 years, and we have always used condoms as protection. When PrEP came along, I decided that I didn't want to take it because there's a risk in side effects, and I thought that that would not be an option for me. Maybe in the future, so today I feel very comfortable using still condoms.
Actions?
Hi, I'm Nick. I'm a community member, and I've been on PrEP for about 2 years. I first heard about it from coworkers in San Francisco, where I was an HIV educator, and at the time it was available through my insurance and through San Francisco City Clinic. So I went to City Clinic and they tested me and I was negative, and they monitored me for about a year. I got tested for HIV and all STDs every 3 months. I never had any side effects, and it's been very positive for me because when I heard about it, I thought about how as I've gotten older, I've used condoms less consistently, and for me as a bottom, it's made me feel more in control of my own health, my own HIV prevention, and it's made me more confident when I hook up or date, and it's made me less afraid to date guys who are positive. When I moved back to Portland from San Francisco, I was concerned about accessing PrEP because I didn't know how knowledgeable doctors and health providers here would be about PrEP or how easy it would be to get it. But I was really pleasantly surprised when I asked my doctor about it, and he said he'd heard of it and he hadn't yet prescribed it for somebody, but he didn't have any problems prescribing it for me. He just had to look into what the copay would be and what have you. And with my insurance, I found out that there wasn't any copay, and he dispensed it within a couple days of me coming back into town and having my first visit with him. And I've been on it ever since.